We are here to talk about an insane act that a woman in Canada inflicted upon herself. Why would anyone spread acid on their face?
Obviously, this is someone with very deep emotional issues. We're talking about emotional scarring here, not just physically, but emotionally. Possibly some sort of a depression going on, obsessive compulsive disorder, but I think we also have to look at something called a fictitious disorder known as Munchhausen's, where a person will either feign some sort of illness or injury or actually harm themselves in order to get medical attention, constant medical attention. And this is a way that they can get not just that attention from medical personnel, but from also those people who are around them. So they're constantly craving people coming to them and talking with them about whatever their illnesses are.
So let's talk about Munchausen for a second. Are certain types of people predisposed to having this syndrome? Perhaps people who were in the hospital a lot when they were younger or used a certain amount of attention. Where does it come from?
We're seeing two groups of people where Munchausen's may be more prominent for. One group is exactly as you said, would be someone who has been hospitalized very early on in life and now has come to learn that the best way to get attention is by continually being ill, whether making it up or injuring themselves to get that medical help. And we call them frequent flyer mileage folks in hospitals because they're constantly shopping and going to different hospitals and are around doctors and even know medical terminology and so on. The second group would be people who very early in life were perhaps abused or neglected, and so inappropriately will do anything in order to get that attention that they crave or seek.
And, similar, just on the back of what you were saying about these frequent flyer hospital visitors, it seems because a lot of people move from hospital to hospital, it's hard to track what they're doing.
Exactly. It's a lot like, if you remember when Michael Jackson died, and they talked about how drug abusers, they're able to get their prescription medications by going through to different doctors, doctor shopping. Well, that's the same thing that people with Munchausen's may do. Therefore, the hospital folks can't collaborate. The medical people cannot collaborate and say, this is a person, red flag, don't treat this person. So, and people with Munchausen's also keep their family members from meeting with doctors so they can keep the charade, this emotional charade going on forever.
So what can families do? How can they tell if a son or daughter has this syndrome?
Well, first of all, they need to be diagnosed. That's the first thing that needs to happen from either psychiatrist, psychologist, social worker, mental health therapist. Secondly, physicians have to make sure that they go through all of the symptoms and must be certain that there is not a medical basis for it. Once they realize that it may be more of a psychological issue, then they will then refer them to the mental health people. As for parents themselves or family members, if you know someone who's constantly checking themselves in and out of hospitals, who have symptoms that are so amorphous, that are constantly changing, that after they get treatment for a certain illness, all of a sudden they get sick again, or they have a different kind of illness. But I think the most important thing that they will see is that that person may have some sort of a depression, anxiety, obsessive compulsive disorder, where they're constantly talking about and obsessing about these symptoms that they feel that they have, when in fact, if you are close to them, you realize that it may not be real. The other thing, quite often doctors will see if someone does come into the hospital are multiple scars on the abdomen or certain parts of the body from different operations.
Wow. That's intense.
Well, it is. But, we should point out that the numbers of people with Munchausen, that number is extremely small. We don't have any reliable way of saying how many people really do have this sort of illness because of the deceptive nature of it. So when we see something like what Bethany Storro did, most people who do have Munchausen's, either they create that illness and it's not real, it's never real, or they do something internally. So for her to do something where she's scarring her face is something that is very atypical and we normally don't see. But again, I think people should be aware, very few people do have Munchausen's, but those who do have it, it's a lifelong illness that needs to be treated with psychotherapy, psychiatric medications, if there are secondary illnesses such as anxiety, depression, and so on, and of course family therapy, where friends and family can support that person and appropriately give them the attention that they seek.
Well, it's good to know people can get through this. We have a question now from the chat room. Rick, what are we hearing?
Well, we have two questions. You already answered that the disease is not that common, which is, of course, one of Sandra's questions. Her second question was, does it have different degrees of severity?
Yes, it does. I think with any kind of emotional illness in this particular case, someone can have a very mild form of it where they never do really become ill or don't cause themselves injury, but they're constantly complaining that they have certain symptoms. And then you have to be all the way at the other end of the continuum, and not even talking about Bethany Storro in this case, where someone may be swallowing objects or swallowing certain liquids and so on in order to cause certain types of injury. The other thing is that person who's constantly getting treatment, constantly taking medications, constantly getting surgeries for something that's not even real, secondarily can harm themselves too, because that will start to affect their body and their immune system.
Go ahead.
Yeah. How do you separate Munchausen's from being a hypochondriac, let's say?
That's a great question. People with hypochondria are not necessarily looking for the secondary gain of getting the attention of others. They just are not able to process whatever emotional pain that they have, and it gets converted into physical symptoms. And they're constantly obsessing about having symptoms that they believe are real. With Munchausen's, that person knows that that symptom is not real, or they will cause an injury that they didn't have to begin with. I actually feel much more sorry for people who have hypochondria because they really cannot help it unless they do get medications for anxiety, OCD, and therapy. The person with Munchausen's, they're actually more in control of their fate. We're looking more at a personality disorder, and in many ways it's difficult for them too.
And people with Munchausen's have actually gone under the knife? How can a surgeon allow someone who doesn't really have an illness or some kind of condition to go into the operating room?
If the person constantly complains that they have some sort of a symptom and the surgeon cannot find it, they can't do imaging and so on, or it's not showing up in the imaging, they might do an exploratory surgery and go in to see what may be going on. The other part of that is what you had spoken about earlier. If there is not any corroborative evidence or other physicians talking to one another or hospitals talking to one another, someone can go to a different hospital. Medical records are not transferred, and therefore they're able to get these surgeries. And we should also be aware, once again, that there are people who swallow objects. They take certain medications or chemicals that may burn them on the inside or cause certain types of symptoms, and therefore the surgeon may have to go in to see what's going on.
I'm getting squeamish just hearing about this.
A little bellyache from that one, right?
A little bit. Thank you so much, Doctor. It was very fascinating to learn about this.
It's my pleasure.
Nice to meet you, too.